welcome Dr. 𝗚𝗚-𝗃𝗀𝗃, COO, Aksha Hospitals, Neha Lal, AVP and Head, Strategy and Operations, 𝗛𝗍𝗍 Healthcare, Hemant Bhatnagar, Director, Narayana Hospital, Ahmedabad, Dr. Chintan Dwivedi, CAO, 𝗔𝗜-𝗘𝗍𝗶𝗁 Hospital, Sonia Mishra, Director, Health, 𝗦𝘂𝗀𝗃𝗀𝗃 India, Ashisht Vidyarthi, Co-founder and CEO, Product AI, and moderating the session is Ms. 𝗕𝗁𝗃 Sharma, Senior Vice President and Chief Strategist, Digital Health News. Please welcome all our panelists and moderator with a huge round of applause.
Hi, good afternoon everyone, and we are pretty late for the lunch, so apologies in advance. But for next 40 minutes, so we'll be unpacking really good insights of AI. So we will make sure once you're walking out of the room today, you have a mature view on AI, how it is getting sustainable, and what we need to do differently when it comes to AI in healthcare. So I'll take a moment, and thanks everyone to join the panel. I'm really grateful to host each of you, and thanks for taking out time from your hectic schedule. I would like everyone to take a minute and give a short, crisp introduction about what you do and what kind of insights are you looking forward to for today and what organization you come from. We'll start from you, sir.
Thank you so much. Myself, Dr. 𝗚𝗚-𝗃𝗀𝗃𝗀𝗃. I am leading Ashka Hospitals Limited in Gandhinagar as COO. And along with that, I am at the intersection of being a founder of Healthcare AI platform. So we are building something which really the ecosystem needs. And we are working deeply on it with our tech team. So yeah, thank you so much.
Thanks a lot, sir.
Hey everyone, this is Neha Lal. I work for 𝗛𝗍𝗃 Healthcare. We have a couple of what we call BU hospital, which is 100-bed hospitals, plus we are coming up with the large healthcare projects. So I contribute to the strategy, I contribute to the complete operational and the digital strategy as to how the design should be made so that one, it's sustained, second, it's scalable. Thank you.
Thank you very much, Varsha. Before introduction, I am little worried about the buzzer. And I am sure that is not regulated by AI. Anyway, just to give you a brief introduction, myself Hemant Bhatnagar, and I am associated with Narayana Group of Hospital at Ahmedabad in the capacity of director. We have 22 hospitals across the country, 10 hospitals in UK, and 2 hospitals in United India. And the group is being very aggressive in terms of digitalization and adoption of all the digital techniques and AI. That's all. Happy to be here today to have a fruitful discussion with this august group. Thank you.
Thank you. Myself, Dr. Chintan Dwivedi, working in healthcare industry since last 30 years, from different vast experience from 50-bed to 500-bed. And my interest is for digital platform for any healthcare industry. So I am working for different type of HSIs. So now I think today will be the best communication matter.
Yeah, good afternoon once again. Ashish Vidyarthi from Product AI. As I just presented, we are an agentic AI company trying to create an intelligence layer for the entire patient engagement. But what we would like to have in this panel is how, as an innovator, what are the challenges, what are the things, how we work with clinicians and hospitals and making the real world problem getting actually solved with AI.
Good afternoon, everyone. My name is Sonia Mishra. I am Director Health from 𝗕𝗺𝗃𝗀𝗃𝗀𝗃. As an organization, 𝗕𝗺𝗃𝗃𝗃𝗀𝗃 works with governments, institutions, hospitals, and various other healthcare nodal organizations or bodies in supporting them to lead with the digital charter, along with helping them move forward with achieving the ultimate goal of patient care and patient safety. Delighted to be here in this group and this panel. Thank you.
All right, thank you so much. AI is becoming a part of conversation. When we talk about healthcare, there should not be a single day that we are not discussing AI. AI is probably the most discussed technology today, and we know the potential. So we are not going to talk about the potential AI holds, but we're going to talk about sustainability in the hospital, how AI operates, at the intersection, what actually sits. And we'll be having the real insights from people who are deploying, who are implementing, and who are struggling when it comes to AI standardizations and data governance. So let's start the panel. So Dr. Vipul, let me start with you. When you're looking at a hospital from an operating perspective, efficiency can mean in many ways, right? We can save time in one process and still not necessarily change how the institution performs. So what would you actually want to see change before you say, yes, AI is genuinely improving how the hospital performs at the intersection of technology and creating the same amount of impact and sustainability?
So, actually, let's talk about the efficiency and the transformation. Efficiency is always a technical output, while the transformation is the true impact. So efficiency is a table stake, and transformation is the ground stake. So what I believe is any output is of no meaning if it is not impactful. So how I see that in any institute, the true AI solutions are transforming the processes. I can divide it in three parts. One is the clinical part. So AI should not just make the clinical workflows faster. It should create the clinical intelligence which augments the skill of the consultants. It should be more accurate, more precise clinical intelligence should be created. And then we can say that it is transforming, the system in the hospital. The second part is the revenue cycle. So, when we are working in our startup on the RCM model, everyone here are the CX opposition people. So everyone knows that, almost 12 to 18% of the revenue is being, missed in the leakages, which is being done silently. No one knows, and this is being done. How? Because of the coding errors, because of the delayed authorizations and everything. So, but these problems are, pattern-based problems. And that is where the AI works, because AI works on the pattern-based problems, and that is why we are solving the problem so that, the current revenue which are being missed or written off, that can be recovered. And that is how the transformation happens. And the third thing, the most important, is the patient experience. Very recently, someone has talked about the discharge summary. It is the, everyone knows that it is the biggest headache in the discharge process. Because discharge process starts with the discharge summary, and discharge summary preparation itself takes 3 hours, 2 hours of time. And if we can have some solution on which we are working also, that the 2 hour or 3 hour of process we can cut out to 5 to 10 minutes, and it will, enhance the experience of the patient during the discharge. So this is how I look at the transformation in hospital using the AI solutions.
So, sir, there are a lot of aspects that you spoke about, right? You spoke about data clinical expertise and cost. So where would you expect that value to become visible first? We have several factors: capacity, cost, clinical time, patient experience, and if somewhere else you want the impact to see first.
So for that, I have designed the signature framework, which I know as the circle of confidence. So there are 3 layers in this section. The innermost layer is the clinical part. The outermost is the operational part. So I think because there are people with clinical decision support system are here. But until and unless, I believe, because I am a gynecologist, I am a clinician, and turned into a healthcare administrator. So I believe is until and unless we have the validated data in the system which is being used by the AI to give the output, we should not jump onto the clinical decision support system. So to start with, I would prefer that all the tech people, all the people in the industry, if they want to start with, they should start with the non-clinical operations. then it should move towards the billing part, the financial part, and the revenue cycle part. And the third, it should be the clinical decision support system. So the circle says that we should go from outward to inward, not the inward to outward. So this is how I can picturize it.
Great. I was expecting data to be the right answer, because without data, we cannot run our AI models, right? First, we need to work on structuring our data inside the hospital. In what format we are storing the data. Data is actually, I got this opportunity to go through, the formats of data, how it is stored. As small as a clinic, as big as a hospital, there are a lot of data breaches. We are not able to structure it in a right format. Now, in a single hospital, in different departments, patient data is very unstructured. Like in ortho, it's a different format how data is stored. I mean, data is the real problem when we talk about AI, so I think I agree with you. And how many people in this room agree that data should be first looked into when we talk about AI? If you can raise your hands. All right, that's great. So a lot of people agree with you, sir. All right. Neha, that brings me to the leadership side of this, because once we know that value should look like, what we need to do, somebody still has to decide where we need to invest, right? So with strategy and operations, you're looking at these choices at an institutional level, and today there is a certainty, no shortage of possible AI use cases. So when leadership has so many possibilities in front of it, what makes an AI problem important enough to deserve serious investments and scale?
Well, it said the data is a new money. I don't know how far we have understood it, but then AI per se, I have attended so many lectures, and I would say the sessions who are coming from AI and strategy leadership content, and I have learned that AI strategy is just about timing. We are on the right time, number one. AI is not mere technology. It's not at all technology. AI is a micro-economic force which is happening in our country and other countries as well, where the China is completely ahead of all these times. So I've understood China has actually removed and taken off some of the academic courses, like 12,000 plus courses they've taken off. They've introduced 10,000 more courses just to support the AI which is going to come, and AI has to survive after 10 years or maybe 2 decades. So they have revamped the whole thing. We talk about the data. They are creating kind of an educational system for the students so that they get the right talent to support AI strategy. Now look at India. We are so far. I so remember the days where we were starting to implement mere HMIS. And there is a huge resistance from the doctors, and not resistance from the staff because they are not that capable to use HMIS because they are not trained enough. So the training part actually takes a lot of things. I've seen the products, just 2 presentations from the gentleman, new present and the up-to-date, because I know the product up-to-date. Now, of course, all of these solutions are good, but then as a hospital administrator, as a hospital leader, or as a operational professional, those who are working in the hospital as a nurse, what are their challenges? What are their issues? Where are these key stakeholders who are talking about AI? Where are these people who wants to understand AI? We are quite ahead because we know, we are exposed. We know the digital thing. We speak at the conferences. We learn from each other. But how about those stakeholders? They want to understand up-to-date. Where are the clinicians, those who are driving up-to-date, or CDSS? Where are the nurses? They are the very core part of the whole clinical care delivery model. So, in my opinion, the AI is just 20% technology and the digital infrastructure, but the 80% is a people mindset. It's all about the people mindset. How are we taking? I'm very happy using Swiggy, Zomato, and Ubers of the world because I am the customer. I'm happy about it. I'm using those technology. Where is customer? Do we have patient here? You're talking about the impact. Patients do not understand what is NABH. Right. We understand. For them, the doctor and the experience that matters. Its onus is on us to cultivate that value to the customer, to the patient, that you are in a safe hospital because we are XYZ. Similarly for the AI, I have seen the times before 2 years, I think people were actually scared कि यहाँ पे तो robo से surgery होती है, doctor नहीं करता. So that trust factor was not there. Now in metros, patients are asking, do you have a robos? now we have shifted that you have a robots because now they understood that how robo works thanks to the chat GPT. Now I know that how the robo moves, and that capabilities robots can come. So now the consumer as a patient, they are aware what they want. So we still have a lot of time. I don't see AI becoming the leapfrog here. It has to cultivate the impact. It has to cultivate. I want to see the people who are sponsoring this, whole of this digital initiator and entrepreneurs to talk about the KPIs on the patient outcome as well as clinical outcomes. अगर CDSA से ही सारा treatment protocol बन जाएगा तो doctors क्या करेंगे? We have lot of ifs and buts because the AI does not only support the clinical care, as someone has just pointed out, it's about the genetic makeup, it's about personalized medicine. It is more to do with how you have made them feel while you are taking the discharge. So that is something I think all the partners here, all the people here should actually ponder to, and then the roadmap can be decided. So this is my thoughts from the leadership. Speaking on our plans as a Adani, we rely on the data. Our project, our hospital, every inch should create the data because as you mentioned, the data is going to create the digital infrastructure, and then top of it, you put your algorithms and research, and we create an ecosystem where our patient, our client, is completely not taken care of for that particular admission to discharge, talking about the whole life cycle management. So for us, the data is way, way important, and that is where we always strategize, we always brainstorm as to what the patient wants. And all of these key stakeholders then, align with that particular goal and that particular purpose. So that's a very, very beautiful thing when you keep the patient in the center and then evolve around. And then everything will fall in place. Let doctor be known that these are my advantages. This is something which will a huge help for me when I use XYZ system. Let the nurse feel empowered. Let my 80% time taken off from the operational readiness or operational SOPs. But I think we are not yet ready for the SOPs to run this AI, whatever solutions we are bringing in. So AI आया, आपके पास budget है, आपने कोई device ले ली, but then again, lot many system, lot many software, lot many HMIs, EMRs, they do not talk to each other. We don't have the lake of the data where we are making real difference. Thank you.
Thanks a lot for answering. Talking about Adani Healthcare, we'll come back to you on the gaps that you're trying to solve. Now, my question is to Sayu. As I mentioned, India is incredibly diverse, right? Realities, challenges when it comes to healthcare changes region to region, city by city, sometimes within 100 kilometers. So I want to ask you, let's say there is a solution working well in a hospital in Kochi, might not work well in a hospital in Ahmedabad, right? Because patient population is different, the language we understand is different, kind of background we come from, problems, challenges, realities. So sir, at leadership level, what you should evaluate when you're going to have one solution coming into your hospital and trying to solve problems and not taking a benchmark of it is working well in a hospital in different geography?
Thank you, Varsha. Very elaborate question. But before I jump to answering your question, I would like to spice up the discussion a bit for the purpose of benefit of this august audience. And I could make out that there are a lot of entrepreneurs as well as doctors and IT professionals sitting in this forum today. Please excuse me, my previous two speakers have talked, giving two examples. The first one said that we need to focus first on non-clinical aspects, right? To save money and fasten our process. I beg to differ on that. Any technology, any new intervention, anything which comes for advancement, ultimately we have to understand for healthcare industry for which we are talking today. The fulcrum of that is whom? It's the doctor and nurses. Primarily, we should have a technology which should give them an augmentation and felicitation to deliver better, right? Ms. Neha also talked about data mining and she talked about strategy and all. That's fine, all said and done is good, but ground realities is entirely different. Coming to your question specific. As you have rightly mentioned, whatever is relevant in Kerala is not relevant in Ahmedabad. So as a leadership perspective, how we should look for an organization that how to have the AI system in an organization. Now, My simple answer or the practical approach should be, it is written on the panel itself in your today's session, which talks about plan, evaluate, and implement. The bottom line, it talks about the 4 steps which I am going to talk. Give you an elaborative answer to the question. Definitely, AI is nothing, it is an algorithm or something which works on the data which you feed in. The BMI index for United States or Western world patient would not replicate or similarly applicate to Indian context or Asian context. What they call it overweight may be different context in our scenario. So as a leader, if you want to adopt AI in your system, first thing is you need to have pilot. And instead of adoption, I would say adapt. The analogy here is you need to adapt to the local circumstances because we represent the country with 140 million people, add with diverse culture, language, ethnicity, and the very important point what Neha has mentioned, training. I may have a world-class software which will have an automated system which will run on its own, but the user is not very familiar with the linguistic competencies. If my HMI system is not compatible to what I have brought in from the outside, it is not matching to the bandwidth which is required. The backup data on which the entire mining and decision process will happen, it's not compatible, it won't work. And then you will have a sunset point. Let us avoid that sunset point. The best approach would be adapt. According to your requirement, have a pilot, then run a pilot, and then you can implement at a larger scale, right? That's how at Narayana, we are going into a phase where at 𝗏𝗔𝗃𝗃 Hospital in Bangalore, Dr. Shetty's, this video is available on YouTube and all the social media platform itself. We are going to create a hospital which will not have any additional administrative bandwidth deployed. The hospital will have purely people, those who are required to deliver direct patient care. Rest, all the systems are going to get automated, right? So the point here is the machine is not going to replace the human capabilities. Definitely it will assist the doctors and nurses to give better decision, better data mining, and better precision. I'll come into detail, if you allow me, to talk on this topic. But specifically to your question, let us not simply adopt by seeing some conference or some presentation or looking at a competitor, they have taken something, we should immediately replicate. वो काम नहीं करेगा, right? We should have a small, as per our capabilities, as per our regional requirement, as per our employees' capabilities. They are the one who are going to use it. And finally, doctors' comfort. We should have that software in place. That's all from my side.
Yeah,
Thank you.
Thanks a lot, sir. So my question would be from you, Dr. 𝗏𝗃. We've spoke about technology, workflows, clinical aspect, and data, of course. So you sit at the top of clinical lens, right? So from your standpoint, I want to understand from you, again, as Ms. Neha and Sir mentioned correctly, we cannot have the solution deployed correctly in a hospital if training is not there, right? If there is a resistance when it comes to patients as well as clinicians. So what do you think, what actually makes clinicians and all the administrative power which is there trust the solution and less resistance to adopt to the technology and similarly to the patients? What kind of infrastructure and from the clinician standpoint?
Yes, thank you, Varsha. Mostly it happens that every healthcare industry, every healthcare unit have their own workflow system, which is differ from every hospital to hospital. And similarly, it happens with all clinicians, those who are practicing individually, they have their own practice system as per their ease. Whenever it's a matter of accepting digitalization, whether it is in clinic, whether it is in hospital, the clinician or my co-speakers are told about the nursing staff and the person who was sitting on the admission part or billing part. So everybody needs to accept that digitalization easily according to their workflow. If currently I am using such kind of ABC workflow in my hospital, and from tomorrow, due to this bigger conference, I am accepting or I am adapting any new technology. So my workflow needs to be changed. because this unit, this AI or whatever digitalization is not supporting as per my own current process. If it is happening, there are a lot of obstacles will be happen. First it starts from reception to everywhere, and the major problem with clinicians. Those doctors are not comfortable to use it or accept it, whether it is not accepting or following their own current workflow. Another part is also the important part, what we say, that IT industry is saying in paper we are reading that AI will replace humans and a lot of jobs will be gone out. So similarly, the same threat happens in the healthcare industry also. If consultant doesn't have confidence that this AI will help me, is not replace me in terms of my clinical judgment. If clinicians have that kind of confidence, then only they will accept this AI. So after all, everything depends on the clinical judgment. So clinical judgment in terms of my decision power, how AI suggests me or diagnosis, they prioritize. Otherwise, they cannot replace myself, my clinical judgment. So that is more important part.
Yes, humans should be in the loop when we're talking about AI. So let me come to Asit. Now let me build a builder's perspective in the row. When you actually build a solution and take it to the hospital, where the friction begins? Because we are talking about the solutions a lot, right? We are talking about innovations, AI, data governance, right, when you're building. But when you actually enter into the hospital, what is the friction?
So what we are trying to address is that hospitals should feel that they are getting something, and against that they are paying 1 to 5% of what they are getting. So this problem we are addressing as of now, and I hope it goes well. Thank you.
Great, sir. Thank you. Yes.
I think I really, really value what you just said. Artificial intelligence to the trustworthy intelligence, and that is where we are looking into the healthcare, because healthcare is subjective, very much subjective. So I'll come back to my own issue that we need to understand entire ecosystem of the stakeholders. When I say the stakeholder, it goes beyond the doctors and nurses. We need to sit together, let's say it's an equipment company, medtech partners, the IT partners, the entrepreneurs in the AI, and suppliers, vendors. As we sit together and we look at the problem or we define the situation, I believe the cross-learning from every industry will be different. And that's where people will work together, find some solutions, again, keeping the patient into the center. So it's very much imperative to collab with the pharmaceutical, with the device, with the medtech companies, because I believe as a hospital, we are just service providers. But we have all of this in the hospital, in that particular physical infrastructure to progress. Number two, on the digital infrastructure, the major groups, the major corporate groups, the chain of the hospitals are now having one line items in their capital budget is a digital infrastructure budget, which is 40% now. Why? Because they do foresee that AI is going to come. And this is something we have to have, because the new age clinician, new age healthcare professionals will come up with this requirement as a basic, because we are dealing with the Gen Zs, and those Gen Zs are going to come. Talking about our strategy, we are making the hospital, let's say, for the people 5 years down, 10 years down, how the world would look like. Which kind of patients are going to hit the hospital. And those patients are millennials, are going to be Gen Z. Are we prepared to address their issues as well? So we have to think ahead of time. We have to work cohesively together, come up with the solutions, come up with that mindset so that everyone in the system is benefited apart from the patient. Thank you.
Yeah, thank you, Neha. I think I'll look at from the leader's perspective. And someone has just now referred about Gujarat. So being as a CXO or as a Gujarati person, first thing comes to your mind, Marusu. I'm a non-Gujarati, but I spent more than 2 decades I have spent in Gujarat. The first thing comes either as a healthcare institution head, organization head, or promoter, come what may. Marusu, that means ROI. That does not mean you should look AI as a capex investment. Please understand the fact. We had a session on accreditation, and the guy was talking a lot about coming way and accreditation and its impacts, and he was shared that out of 20,000 hospitals, only 4,000 hospitals are fully accredited. Rest all are at entry level, you know. I'll go a little back than that. Go to ISO. सबने ISO के बारे में सुना है. International Standard of Organization, ISO 7101:2023 talks specifically about this. It focuses on two important aspects in the entire healthcare industry. One is caregiver, one is care recipient or the receiver. Whatever investment or whatever decision we are taking, we need to have two people in mind as ultimately who is going to get benefit out of it and ultimately how we can benefit the care provider. So if a doctor, for example, let's take a radiologist right now, and I'm not going to share the detail कि हमारा अभी standards में nurses कितनी short हैं, doctors कितनी short हैं, everybody knows that. You know, there is a lack of manpower. Keep that in back of your mind. Assume a situation, one radiologist is seeing 70 to 100 X-ray per day. Just take a common chest X-ray. And he is seeing the lungs X-ray. And there are multiple opportunities where he can miss a lung nodule which is of 1 mm or less than 3 mm. Yes or no? Right? Whereas if we use the technology amalgamated, it will augment his capabilities. Right? In the same time, he'll be able to see more number of X-rays with more precisions. Finally, who is going to get benefited? Someone who is diagnosed at a very early stage where even a 1 mm nodule is also being detected because AI will pop it up. There is a possibility of lung cancer. Start the treatment immediately. He is going to get benefited. And the doctor is at ease. He doesn't have that mental fatigue or mental pressure कि अगर ये miss हो गया मुझसे and something tomorrow happens in the court of law, I would not be penalized. So from entire healthcare leaders' perspective, we should not look AI investment as a capex line item. We should equate this in terms of actual return on investment. Are my patients going to get benefit out of it? Would it build more efficiency and effectiveness into the system, as well as give an ease to my service providers, which is doctors and nurses?
Thank you. Thank you, sir.
I just want to say one sentence only, that we should accept the AI definitely in the healthcare. And what Dr. Bhatnagar says, like same way, the clinician will definitely support by the AI, but should not be replaced. They should have their own control. At all critical judgment, clinician has to be a final authority. The AI should not be that much of power that it by own it can create, it can replace, or it can start and stop many medicines, or it start or labelize any diagnosis. So that much of AI is not required or not acceptable from my point of view. Clinicians has to have that kind of power. And second thing, the 𝗓𝗔, Dr. Neha just say something about 𝗓𝗔, because nowadays majority parents are depending on their 𝗓𝗔s. So even for my father's pain, I will decide where I have to go. So that everything is depend on AI. I just want to share one short example. My cousin came to me कि मेरे को ये हो रहा है, और I have ChatGPT को पूछ लिया, मेरे को बोल रहा है कैंसर हो सकता है. Just tell me whether I am a cancer patient or not. So इतना AI पे मत जाना चाहिए. Definitely the background what happening here, that is best part. I think Progent, I think last was there, he was there. So that is the best part, that my current HIS, my current EMI, my current CRM are not talking by them own selves. So there should be one platform who can match with each other and give a best report to the leader or something that can be work faster. So the same way, the discharge summary happen, it's a universal problem. It starts from, and everybody is shouting, starting from consultant to relative and everybody. So that is a big challenge for every healthcare, that needs to be done some for that. Thank you.
Great, thank you, sir. Now you can see why we bring in people from different part of healthcare ecosystem. Clinician always in the panel has a different point of view from others, which is quite sensible to me. I think humans should be in the loop. Yes.
Yeah. So the question was, what is that we can take in order to change? So I would like to change the perspective in which everybody is talking, what is the benefit of me? So we all are talking about data, right? Everybody understands data, data is the next fuel and all of that. So let me tell you that data for AI is mandatory. And the data is already there. See, the data is there in terms of every patient ever who has called you. Data is there in terms of all the medical tests. It is there with OPDs, IPDs. It's all there. So asking a simple question, how many of you get reminders that hamare car insurance is due? And until you get it done, they are just after your life. How many of you
even after that?
Yeah, even after that. Perfect. How many of you get reminders that your annual health checkup is due? So what I'm just trying to tell you is the data is already there in your system. Can you create workflows to make it more meaningful for the patient and the system? For example, somebody who has come for an annual health checkup, it is mandatory that he should get another health checkup. Why cannot you create a trigger to automate that process? So very simple workflows, the data is there. There is a simple example, a very leading hospital, I got my mother treated and she's discharged from the hospital. I call up them and every time I call them up, they're like, oh fine, kya hua? What do you want? I'm like, I've come for the last time, I'm just coming for a follow-up treatment. Cannot that hospital just pull up a simple data from all the communications that I've done in the IVR saying, oh fine, you're coming for the last follow-up. So you have an appointment today. So this is what I'm saying, the data is there. So as an AI company, we would want that everybody of you are able to use your existing data, create the workflow, make it more meaningful for the end beneficiary in healthcare. And that's the patient. Thank you.
Thank you. Sonia.
So AI is not the enemy. The enemy is ungoverned, unchecked, without evidence AI. And you know, when you said that ChatGPT sort of gave a prompt saying that you potentially have cancer, well, all of us have faced that situation. And I'll just, you know, share a funny story and, you know, I'll keep it really short. Just a couple of days back, my 12-year-old, she and I were just playing around with ChatGPT and we prompted a question saying that I need to get my car washed. The car wash company or the place where I need to get my car washed is 500 meters away. Do you suggest that I should walk or I should drive? Any guesses what the answer was? Walk. Absolutely. And when I called back and I said, look, it's my car wash, and ChatGPT very, you know, in a very witty manner said that, oh yes, of course, you should go buy your car. So this is the outcome of a, you know, of a chat or a AI tool which is, you know, not vetted, and it's actually using the entire whole wide web. So the questions leaders need to ask when they're embarking on their AI journey, be it in a non-clinical side or on the clinical side, is my AI tool mile wide and inch deep? Or is it inch wide and mile deep? And I think if you're able to get answer to that question, you will actually be able to, with a lot of confidence, move forward in your AI journey, because it is here. You know, AI is knocking at our doors, and healthcare is among other industries which will have no option but to embrace it, adapt to it, and walk along with it.
Thanks a lot.
Thank you.
It was really a pleasure to host each of you, and the key takeaways would be from our panelists. Humans should in the loop when we talk about AI in healthcare. Second, data governance and standardization is something we should put our focus into from the leadership standpoint. From the clinical aspect, clinicians, when we are building a solution, or when, you know, Deepak, you from 𝗦𝗂𝗀, you're coming to a hospital, you're talking about a solution that how we need to deploy it. The clinician has to be in the loop, because you cannot get the same perspective from an IT head or from someone from the technology aspect and not a clinician, right? Because that is the person sitting at the forefront when he or she is treating a patient. So I think a technology itself is not a technology until all the people come together, ecosystem come together from different parts, and then we solve a problem. That's all. I had a good time. I hope you did enjoy the conversation. Thanks a lot.